Okay, so in today's video we are going to be talking about the brachial plexus. I have it already pulled up on a complete anatomy, as you can see right here as I maneuver this quick, going all the way up and then all the way down. So the brachial plexus originates from C5 to T1. The function is to provide motor and sensory intervention to the upper extremities. In my model, I'm just showing you on the left upper extremity, just so you could see one side and not both sides. It splits up into 5 segments. The 5 segments are roots, trunks, divisions, cord, and branches. I remember this by an acronym. It was similar to the video one, but it's just remember to drink cold beers. It's a bit different because I'm gonna be honest, I didn't know who the guy was that was mentioned in the video, but I learned this acronym from my A&P class in undergrad. Okay, so the first part we are going to be covering is the roots, which is the first segment of the brachial plexus. So the roots are otherwise known as the ventral ramus. I already have it pulled up on the model just because I didn't want my head being too far up into the camera. These are the anterior aspects of the roots. So they're known as the ventral ramus from C5 to T1. Their origin is from C5 to C7. They are above each of their designated vertebrae, as you can see right there, while C8 is beneath C7, just because we don't have a C8 vertebrae, and then T1 is directly connected into the T1 vertebrae. Okay, so now we're going to be talking about the some of the branches from this segment. So the first one is, let me just try to zoom in right here. It's going to be the dorsoscapular nerve. It's right here. As you can see on the side, it says the name, and then it's just the left side, just because we are working with the left upper extremity, as mentioned before. Let me try and maneuver this real quick so I can show you. So, the origin of this nerve is a C5 vertebrae. The course of it runs along the inferior medial border of the scap. As you can see, it starts from right here and then it goes all the way right there, just like that. Zoom out for you. There we go. So the muscles this nerve innervates is 1, the levator scap, which is has the origin of the posterior tubercular transverse process of C1 to C4. So it'd be like right here on the back side, C1 to C4. And then the insertion is the superior angle of the scap and the medial border of the scap superior to the spine. So as you can see, that would be right in the scap area. The action for this muscle is cervical and lateral flexion and then shoulder elevation. So it kind of makes sense why this one would innervate, just because the nerve runs in, through the scap. The second muscle this nerve innervates with is the rhomboid minor. The origin for this one is the spinous processes of C7 to T1. And then the insertion is the medial border of the scap. The action for this is scap abduction. The other muscle that this innervates is the rhomboid major, which has the origin of the spinous processes of T2 to T5, and then the insertion is the medial border of the scap. So it would make sense once again, and the action for that is scap abduction and shoulder retraction. Okay, so I wasn't too sure if we were to talk about this, but I found this model as I was going through complete anatomy. So in the video, it talked about dermatomes and how they have associated root with them. So a dermatome is the area of the skin that's innervated by specific nerve levels, and then each sensory neurons in the upper limb has a dermatome course to the associated root. So as you can see, it has all the designated nerves that run through. So C5 would be the lateral arm and forearm to the base of the thumb. Be going right there, run right there. So C6 would be the lateral arm running down from the upper arm down to the forearm and to the base of the thumb. So as you can see right there. And then C7 would be the lateral side of the forearm, thumb side to the index and middle finger. So as you can see, it's lateral side. And then, oh my gosh, hold on 1 second. Just like that. And then as you can see, C8 is the medial side of the lower forearm, wrist, ring, and pinky finger. As you can see, it goes right there. And then you can see the anterior part right there, posterior part. And then you could see T1 as it is the medial side of the lower forearm, the upper forearm, the upper arm, the chest area, and above the armpits into the scapula. Hold on. Turn back. There we go. So just like how each root has a dermatome to go with it, they also have a myotome. A myotome is a movement associated with a specific spinal nerve level. So C5 has shoulder abduction, C6 has elbow flexion, C7 has elbow extension, C8 has finger flexion, and T1 has finger abduction. Okay, so now we are going to move on to the next segment of the brachial plexus. The next one is the trunks. So there are 3 parts of the trunks. There's point it out for you. There's the superior, middle, and inferior. So superior is from C5 to C6. The middle is only C7, and then the inferior is C8 to T1. Okay, so now we're going to talk about the different branches for this section. So the first one, I'm just going to rotate this posteriorly. There we go. And then let me try to click on this. Oh, 1 second. Always gives me trouble. There we go. So this one is, the first one we'll be talking about is the subscapular nerve on the left side. The origin is the upper trunk from C5 to C6. The course it runs is that it runs laterally through the posterior triangle of the scap. So if I shift this downwards, there we go. See, as it runs through the posterior triangle of the scap downwards, and then it goes right into the scap region. Okay, so this nerve innervates 2 muscles, the first one being the supraspinatus. The supraspinatus has the origin of the supraspinous fossa of the scapula and an insertion of the greater tubercle of the humerus. This muscle's action is to adduct the humerus, and then the second muscle that this nerve innervates is the infraspinatus, which has the origin of the infraspinous process of the scapula, and then the insertion is also the greater tubercle of the humerus, while this muscle's action is to externally rotate the humerus. Okay, so following the trunks, we're going to be doing the division. So for the divisions, there's 8 in total. They have 2 each for each trunk, so they have an anterior and posterior. So the anterior division is innervated with ventral muscle masses, or otherwise known as flexors. The posterior divisions are innervated with dorsal muscles, otherwise known as extensors. So if I were to zoom in a little bit, I'll give you an example. So right here is the anterior division for the superior trunk. And then if we go back here, here is the posterior division for the superior trunk. And then if we rotate it a little bit this way, here is the anterior division for the middle trunk. And then this one right in here is the posterior division of the middle trunk. And if we go back here, we have the anterior division of the inferior trunk. If we click this one, it is the posterior division of the inferior trunk. So it's like, it looks a little clumped up and mixed up, which was kind of hard when I was first trying to get familiarized with the model and seeing it like this instead of drawn out. But as I was thinking about it, it was quite easy as I just rotated it this way, and you could get a sense if you look at it at the side from anterior to posterior and how they all connect. So if I were to multi-select the anterior one and then posterior one, right there. So wrong one. I clicked this one. Oh my gosh, it's doing it again. There we go. So, okay, so I did it right. So this is, for example, this is the anterior division of the superior trunk, and then, this is the posterior division of the superior trunk. So as stated before, the anterior division innervates with ventral muscles. So to be more specific on that, the ventral muscles forms into the hand muscles, so that only innervates the hand muscles anteriorly, while the posterior division innervates the dorsal muscles, and that muscle mass ends in the forearm with only the tendons going down to the hand. Okay, so following the divisions, we will be talking about the chords next. It may get a little bit tricky just because that's how it was for me when I first looked at it on an anatomical perspective, not just drawn out, but just because there's so much going on. So, there are 3 chords. There is the medial, lateral, and posterior. They each get their names from the relation to the axillary artery. So I'll point them out first, and then I'll show you. So here is one. This is the posterior chord, and I'm going to just multi-select. This is the lateral chord, and then this one right here is the medial chord. There we go. And then if I were to click on the arterial view, you would see here is the axillary artery, and you can see how it is in relation. So you see how the medial chord is medial towards it, and then, sorry about that, the lateral, and then, okay, the posterior is right there. I'm so sorry. Okay, so next we're going to be talking some branches from each chord. So first we will be starting with the lateral chord. So I kind of zoomed out a bit. So here's the lateral chord highlighted in pink. And then we are going to go into this one right here. Oh, not the rib. Let me see. Maybe that. There we go. So this is the lateral pectoral nerve. As you can see, it originates from the lateral cord. Its course, it runs anteriorly and superior to the medial, anterior, superiorly, and medial to the pec minor muscle, and pierces through the pec major muscle. So if I were to show you, go right in there. So as you can tell by the course it runs, it would innervate the muscle of the pec major as it pierces through that muscle. So the pec major has the origin of the clavicular head, the anterior medial half of the clavicle, and the sternal costal head. The insertion is the crest of the greater tubercle. So it'd be the greater tubercle of the humerus. If I could rotate this, there you go. And the action is to adduct, medially rotate, and transversely adduct the arm at the glenohumeral joint. Okay, so the next one we will be talking about is this one right here. So it is the medial pectoral nerve. It is medial to the lateral. So this origin is from the medial cord. The course it runs is that it runs anteriorly, right here, anteriorly into the pec minor and then the pec major muscle. So it innervates both muscles. So we already went over the pec major, but as for the pec minor, the origin for this is the anterior ends of the 3rd through 5th ribs, and then the insertion is the coracoid process of the scapula. The action for this muscle is that it protracts and downwardly rotates the shoulders. Okay, so the next thing we're going to do is this one. This is the medial cutaneous nerve of the forearm. The origin is the medial cord. The course it runs is that it runs inferiorly down the medial wall of the arm. So as you can see, it goes downwards just like that. The action is that it supplies sensory intervention to the anterior arm and then to the medial surface of the forearm. So medial arm, can't even see my arm, medial arm, and then forearm. Okay, so our next one is going to be in here. I'll kind of turn it a little bit. It's this one right here. It is the superior subscapular nerve. The origin is the posterior cord. The course it runs is that it runs medially and posterior, as you can see right there, and it goes towards the axilla and then towards the subscapularis muscle. So the action of this is that it innervates the subscapularis muscle. The origin is the subscapular fossa of the scapula. The insertion is the lesser tubercle of the humerus, and then the action is that it internally rotates the humerus. Okay, so the next one is going to be right here. The perfect. It is the inferior subscapular nerve. Let me try and isolate it. There we go. So this is the next one. The origin is the posterior cord. The course it runs is that it runs inferiorly along the posterior wall of the axilla, and the action is that it innervates the muscle, the subscapularis that we just went over. Okay, and so the last segment for this one is going to be this one right here. It is the thoracodorsal nerve. So the origin for this is the posterior cord. The course it is that it runs inferiorly in the posterior axial towards the latissimus dorsi. For the action of it is that it innervates the latissimus dorsi. The origin of that is from L1 to L5 spinous processes, and then the spinous processes of T7 to T12, and then ribs 9 through 12, and then the iliac crest, and then the insertion is the intertubercle sulcus of the humerus, and then the action is that its scap abducts, its shoulder adducts, helps with extension, hyperextension, and then depression and medial rotation of the humerus. Okay, and then the last part of the brachial plexus are the branches, and they just originate from the cords. So as you can see, they're all right here. Each one has a specific cord that I will be going over once I go over each nerve. Okay, so the first branch that we're going to go over is this one right here. Click on it. There we go. So this is the axillary nerve. It originates from the posterior cord. The course it runs is that it runs laterally through the quadrangular space and then into the lateral arm. So if we could turn it like this, you'll see. It's okay. There we go. It comes back and then into lateral arm that way. So this nerve innervates with two muscles for its action. The first one being the deltoid, which originates from the lateral 1/3 of the clavicle, and then the acromion, and then the spine of the scapula. The insertion is the deltoid tuberosity of the humerus, and then the action is that it adducts, flexes, and medially and laterally rotates the arm. The second one is going to be the teres minor. The origin for this is the posterior aspect of the lateral border of the scapula. The insertion is the greater tubercle of the humerus. The action is that it internally rotates the humerus. And the other action of this nerve is that it is the lateral cutaneous nerve of the arm. Okay, so the next one is going to be right here. Not that one. This one. So this is the radial nerve. Its origin is the posterior cord. The course that it runs is that it descends from the posterior axilla, passing through the triangular space, and then descending to the radial groove. The actions for this, it innervates with a couple of muscles. The first muscle being the triceps brachii. The origin for this is the posterior surface of the humerus, and then the tubercle of the scap. The insertion is the olecranon process of the ulna, and then the action is that it extends the forearm at the elbow joint. The next one is going to be the brachioradialis. The origin for this muscle is the superior 2/3 of the lateral supracondylar ridge of the humerus. The insertion is the lateral aspect of the distal part of the radius, and then the action is that it flexes the forearm. The last one is going to be the extensor capri radialis longus. That was a big one. The origin is the inferior 1/3 of the lateral supracondylar ridge of the humerus. The insertion is the dorsal aspect of the second metacarpal bone, and then the action is extends the hand at the radiocarpal joint and then abducts the hand. I forgot to mention that this nerve also is the superficial cutaneous branches of the radial nerve. Okay, so the next one is going to be right here. Yeah, oh, yeah, this one. So this is the musculocutaneous nerve of the left side. So the origin for this is the lateral cord. The course that it runs is quite long, so it runs with the third part of the axillary artery, and then it pierces some muscles, and then it enters the anterior arm, and then descends between the biceps brachii and the brachialis muscle. So if I were to zoom out real quick, you would see how it goes down there, pierces all the way down, and then goes into there. So due to the long course, the action of this muscle is that it innervates the action of this nerve is that it innervates two muscles. The first one being the biceps brachii, which has the origin of the supraglenoid tubercle of the scapula, and the cord process of the scap. And then the insertion is the radial tuberosity and the antebrachial fascia. And then the action is that the second muscle is the brachialis. The origin is the anterior aspect of the distal half of the humerus. The insertion is the coronoid process and the tuberosity of the ulna. The action is that it flexes the forearm at the elbow joint. So going inwards like that. Also works as a lateral cutaneous nerve of the forearm. So yeah, just going down. Okay, so the next one is going to be right here. There it goes. So this is the median nerve. As you can see, the origin is the lateral and medial cords of the brachial plexus. The course that it runs is that it goes through the arm and the cubital fossa, and then it travels next to the brachial artery, as you can see, as it goes down, and then it goes down into the forearm. So the action of this is that it innervates a couple of the forearm flexors. So the first forearm flexor is the pronator teres. The origin of this muscle is the medial supracondylar ridge of the humerus and the medial aspect of the coronoid process of the ulna. The insertion is the medial 1/3 of the anterior aspect of the radius, and the action is that it pronates the forearm at the aspect of the radius. No, pronates the forearm at the radial ulnar joints. The next flexor of the forearm that this nerve innervates is the flexor carpi radialis. The origin is the medial epicondyle of the humerus via the flexor tendon, and then the insertion is the palmar aspect of the second and third bases of the metacarpals. The action of this is that it flexes the hand at the wrist joint and then adducts the hand. The third one is going to be the palmaris longus. The origin is the medial epicondyle of the humerus. The insertion is the palmar aponeurosis and the flexor retinaculum of the hand. The action is that it flexes the hand at the wrist joint, and then it stabilizes the palmar aponeurosis. The next one is going to be the flexor digitorum superficialis. So the origin of this muscle is the medial epicondyle of the humerus and then the tubercle of the ulna. The insertion is the palmar aspect of the middle phalanges of the index, middle ring, and then the pinky, or otherwise known as the little finger. The action of this is that it flexes the index, middle, and ring finger. This nerve also serves as a superficial cutaneous branch of the median nerve. Okay, so the next one is going to be right here. If I can press it. There we go. So this is the ulnar nerve. This is going to be the next branch that we talk about. This originates from the medial cord of the brachial plexus. So let me try and zoom out for this so I could show you how it runs. So as you can see that it descends on the medial side of the arm, and then it runs with the brachial artery, and then it pierces the medial intermuscular septum to enter the posterior arm. So if we move it backwards like this, and then it enters the palmar aspect of the hand. Let me kind of move it down. There we go. See how it goes into the hand. Oh, right. There we go. So the action of this nerve is that it innervates some of the intrinsic hand muscles, the first one being the flexor capri ulnaris. The origin of this one is the medial epicondyle of the humerus, and then it proximal ulnar body, and then the olecranon of the ulna. The insertion is the pisiform, the hook of the hands, and then the palmar aspect. And then the action for this is that it flexes and adducts the hand at the wrist joint or the radio carpal joint. The next one is the flexor digitorum profundus. The origin for this one is the medial aspect of the coronoid process of the ulna and the superior anterior medial surface of the ulnar body. The insertion is the palmar aspect of the distal phalanges. So for the index, the middle, the ring, and then the little finger. The action for this is that it flexes the index, middle, ring, and then little finger. Then the last one that I almost forgot was the palmaris brevis. The origin for this is the palmar aponeurosis and flexor retinaculum of the head. The insertion is the skin along the medial margin of the hand. And then the action is that it wrinkles the skin on like hypothenar, which is really like the hand gets too wet. And then it also hollows the hand, and then it assists with grip. And then this nerve is also the superficial cutaneous branch of the ulnar nerve. Okay, so I may have missed some of the intrinsic hand muscles that one hits, just because there are so many. But I know those are 3 for sure. But yeah, that is today's video on the brachial plexus, and how it innervates at different segments, and then how it innervates different muscles, allowing the body and nerves to have different tasks.